Thank you so much. This is going to take less than 2 minutes. We've already talked a lot about the education, and we had a committee that constituted of Mr. Joseph Afiandata, Professor Kemsi, myself, and one more person. I'll give you the name in a minute. And basically what we looked at were 3 different programs that could be useful to Lecudo. No, I'm dealing with it. So we already talked about the community schools, and the education report was strongly in support of having a community school program that is being continued, the one at Belenge. And so far, we gathered information that there are 49 pupils in the like primary school children that are participating, and they are already taking holiday classes, and we expect that enrollment will increase as of this September when schools resume in Cameroon. The teachers that are there now are volunteering, and so we have a need to buy books and also to support them with maybe paying some of the teachers. The estimated budget for that we are hoping will be helpful for the first probably year is $1,500, $1,500, which will equate to a little over 800,000 francs CFA. The second project regarding education that we looked at was to impact the IDPs who are in Chang. The hope was that we'll be able to provide assistance to primary school children who are attending private schools in Chang, because a lot of them are in the private schools. And we also estimated that there will be over 250 students there, and we are also requesting for about 1,500 that will help in that project. The third and one that will impact us directly here will be to have summer Nwe language programs here in the US, probably one in Washington, D.C., one in Boston, another in Ohio, for our middle and high school children. So it serves almost like a summer program for them, where they can come in, and we will use some of the materials that Dr. Mbecha will provide so that we can train them on the Nwe language. We also estimate that we will use volunteers to do the teaching, and the total cost of the project will be about $2,000. So those are the 3 projects regarding education that we focus on, or that we're able to come up with. And if you look at all 3 of them, the total cost is about $5,000. And so the committee would like the convention participants to look into whether we can get that sum to move forward. Thank you.
Thank you, Education Committee. That was a very good report, and that was brief and understandable. I expect that the other committees will meet this level of performance. The Humanitarian Committee will come next. After that, we'll have the Reconstruction Committee, and after the Reconstruction Committee, we'll have the Health Committee.
Thank you for the correction, Lecudo. All right, so ladies and gentlemen, we were tasked to provide humanitarian assistance to the IDPs at home. And the money that was provided was well spent. And the people that we touch can testify that whatever we did went so far to relieve some of the difficulties that our people are facing. So the food distribution to the IDP started with those in Western regions, because based on the population that is in that area. So we realized that the best to reach the largest population will be to address or target those areas that our people are more rampant. So the members of this committee were Dr. Edmund Falafak, Mrs. Patricia Morfo, Mrs. Sheila Temkin, Kim Thomas Lecker, Dr. Alemji, and Dr. Julius Fomenga. So please move to the Next slide. Can you blow up? So how did we were tasked to perform this job, and in order to gather the necessary data, we had to reach out to those at home, and to do that, we also invited various presidents in the U.S. from various locations to bring in their knowledge base on where the people from those individual villages are located. So we call out to the general population of presidents and their representatives in the U.S. to be part of this discussion so that we can be able to really capture a cross-section of the people. Some villages turn out, but some, as you know, did not turn out. We decided to start in the Western Province, where most of the IDPs were located. The village president and representative in the U.S. contacted their representatives in the areas where food was to be distributed at home to provide names of IDPs from their villages to the committee in Chang. Chang was like the hub of where all this was going to be managed. So the committee in Chang helped collect names of those without representatives and any other persons whose names were missed. The committee in the U.S., working in conjunction with those back at home, determined the most useful items to the IDP. For example, the rice, soap, granite, etc. And these items were identified by those on ground zero. We did not, impose what would be given. So they were the one that decided what would be of good for them. So estimates of quantity of food was also based on the numbers of people present. Next slide. So based on the total number of IDPs, the final quantity of food and items was estimated. The committee back home then provided us with the estimated wholesale prices, which was used to request the budget from the ESCO. The committee in Chang opened an account at a major credit union in which money from the U.S. was deposited and withdrawn when needed. So the actual food distribution took place in January 3rd to January 16, 2021, because of the logistics and challenges in transferring money on ground zero. Next. So we had about 23 villages representing at home. So you see, it was a very, very detailed and collective effort. So those in ground zero really worked very hard to do this distribution. It's not an easy task. So we had 23 representatives of each village who know where their own people are from each village to get all these people together. Okay, next. So the money received, the initial projected calculation for the IDPs was 9 million CFA. On December 20, the BOT approved 8.3 million for the IDP assistance to be added to the balance of the 643,000 that was being kept from previous project. Because more people showed up than previously budgeted for, the Humanitarian Committee requested a supplemental budget of 914,000 on January 5th, 2021 from the ESCO, which was approved. Because of the time crunch, the money was transferred at different exchange rate. Total amount of money received by the Humanitarian Committee chair on behalf of the committee was $17,418. Now, you will see that those on ground zero who were managing the funds presented a report of what the money was used for. They actually broke it down, and if anyone is interested, due to time constraint, you will see how the money was broken down, what was given to where, which areas were covered. So you had people who were in Chang, people who are in Bafusam, people who are in Melon, people who are in Fumbat, people who are in there's so many in Bunda. So there's so many areas that this money was distributed to. And at the end of the day, they had so much turnout. Go ahead, please. Okay, come on. Keep going. Again. So you can see some letters of appreciation that were sent. This one is from the Lecudo in Bafoussam, appreciating what we did for them. So you can see, look at some of the food distributions that were the purchase of food that was there. Okay. All right. Just play a video there. Yeah. Keep going. All right.
More food arriving. That's rice being uploaded. While the people look
So you can
on,
see some of the collection and how people were very, really appreciating what we have done. So you see the money that we sent really far to address some of those issues. Not all the issues, but at least it shows the concern that we all have. That is why, as we continue to look for money, if you look at these pictures and see the smiles on these people's faces, please do not relent to give more money, because they need a lot of our support. So this is just a summary that due to time, I could have gone more in detail, but we're just going to cut it short. But this is what the money that was given was spent. And all the documents are there for your review at a later time. Thank you.
Hello. This is a very important issue. Let's listen very carefully. When we had the CEO of Legda come in today, the only point that he said he doesn't want us to do is the insurance. You must be thinking that he saw something really good in this, and he thinks we are going to do it so well. He's already a little bit skeptical. So we need to really listen and let's get the best out of it. So the insurance fund that the Lecudo is proposing, or that the executive and the leadership is proposing to us today, it's called Leban Social Fund. This is to serve Leban. This is to serve us. This is our own benefit from being part of Leban in the United States. And our mission is to support our community and who are bereaved, and to also make sure that when one of our members dies, he gets a befitting burial, whatever that means. We want to relieve ourselves of the burden of paying for cops to go back home, and also relieve individual families of the burden of dealing with that by themselves. So the vision is to make sure that we are not spending excessively. To send the cops back to Cameroon costs about $15,000 to $20,000. We know that. And even to do a burial here in the United States, which is something we have been doing recently, it will cost us about the same thing. So the vision is to make sure that every family that loses somebody who is a member of this group does not have to bear that burden alone. We make it a community burden, because we're already doing it as a community anyways. So how do we get here? How do we conceive this idea? The idea was conceived by Lecudo leadership, the executive and the BOT, and a lot of elites from Leban. There were so many consultations that were heard by the CEO, the current CEO, who has worked diligently on this issue. He met with a lot of village organization leaders. He met with the BOT, he met with a lot of our community partners, and he even spoke to people who would seem like competition so that we can get the best out of this. We had more than 3 Zoom meetings that brought together a lot of people in the community. A lot of the village meeting presidents were part of the meetings. And every idea that we have here is not what the leadership thought it would be best. Is what these people who came in contributed and thought we should do to move this forward. And during those village meetings, we developed a framework. So what I'm presenting to you today is not a final copy, it's not a verdict. It's a framework that we need to improve on so that we can get the best as we move forward. And the proposed framework, the very first thing is, what are we going to call it? We will call it Leban Social Fund. And registration will be for Leban USA. So if you're a member of this meeting, you'll be able to get access to this program. And we are going to make this an independent legal entity, which means it's not Lecudo USA, it's not part of Lecudo USA. It's an independent organization, but which is run by Lecudo USA. This is because of technical and legal issues, because our status will not allow us to run such a program. But we will do it as an independent entity that is run by Lecudo USA. So the management is going to be done by the stakeholders. Who are the stakeholders? You and I. We are all the stakeholders. And we also said it will be run by a 5-member board. How are we going to select the board? The board is going to be made up of Lecudo USA executive. They will give us a representative. We will have WDC. They will give us a representative. The Ohio chapter will give a representative. Boston or Massachusetts will give a representative. And the BOT will give another representative. So that gives us 5. We were also thinking that one of the largest village organization that also participates will give a representative. But at this point, we're at 5. So that's something that we can look at down the road. And who can be a member? If you belong to this meeting, Lecudo USA, so if you pay $100 and you come to conventions, you can register directly to be part of the project. If you belong to a Lecudo branch in Washington, D.C., Ohio, Boston, you can also go through your branch to become a member. If you belong to a Leban Village Association or organization, Nzensha, Chembin, Chenfem, Lekong, whichever, you can also come in through that route. So we have 3 ways to access the program. And this is only for Leban. You can come in Lecudo USA directly here, Lecudo chapter, or Village Association from Leban. And registration will be open throughout the year to everybody who is eligible. If you can come in through one of those 3 routes. Registration fee, we are proposing $10. And when we complete our registration fee, we'll fill out a form. And one thing that we are asking is that you designate a responsible party. This responsible party is the person that, if there was an event, we will make the check payable to them. And the reason we say that is because we plan to make our payments in US dollars only. So that if you join, you will not have your representative over in Britain and expect us to make payments in pounds. So, and what will be the benefit? Each time we lose a member, we are proposing that the total amount to be paid will be $15,000, regardless of whether the person dies in the US, in Canada, in the UK, or Cameroon. And this is a contrast to some of the other plans out there. So if you're a member in good standing, the US. How will someone lose membership or their benefits? If you are not up to date. So if there was an event and your chapter or your branch contributed and your name was not on it, then automatically, if something happened to you, you will not be a member. Number 2, if you are still on probation. And we are saying that there will be a probation period. I think we agreed on 90 days probation period. And during that probation period, you cannot get any benefits. You will lose membership if you live out of the US for more than 6 months. So if you move to Canada after 6 months, automatically you are no longer eligible for the program. This is something for Lecudo USA, not for Lecudo worldwide. So if you are in another country, we will expect that you will join Lecudo there. But the goal is that those of us in the USA, this should be a benefit to us and our families. And if you are enrolling through Lecudo USA, which is this mother branch, if you don't contribute your money towards the annual dues, you automatically lose your membership. Because the only way you are joining the program is to be part of Lecudo. This is a purely LeBanc thing. We are trying to really build LeBanc so that our numbers should mean something. When do we plan to get this to take off? We are projecting January 2022. That's when the program will take off. Registration, we are hoping that people can start registering now, knowing that the program will take off January 2022. There will be no premiums now, even no one will be a full member until the program takes off, because there is still a lot of work that will be done. And we are also hoping that when the program takes off, for the very first few deaths that may occur after it takes off, we will have Lecudo to subsidize, because it's a benefit to its members and people who participate in Lecudo, so that the premiums that we charge those who participate will not be that high. So the hope is that we will have Lecudo to do some subsidies. What is it going to take for us to take off? We need to develop policies and develop procedures. That will be done behind the scenes. We will need to do some research and registration of the legal entity so that we are complying with the laws of Maryland if we register it here in Maryland. We will need to present those policies that are developed to all the stakeholders, including the chapter meetings, so that we can get their buy-in and their approval before it can take off. We will also need to nominate the board once everything is approved. And we will need then to move forward and launch the program. What are some of the issues that we already are looking at? Something that we think everybody needs to pay attention to at this point. We are hoping that Lecudo can do a fundraising just to kick off the program. That way we can take off some of the costs that will be associated with starting an insurance program of this nature. We are also hoping that if we don't do a fundraiser, Lecudo can guarantee up to $20,000 during the first 4 occurrences, so that our initial contributions to cover those events will not be more than $10,000. We are also thinking that there may be a possibility to do graduated benefits, so that instead of us coming in on the first occurrence and saying we are going to pay out $15,000, if we cannot raise funds and we don't want Lecudo to spend the money, maybe we start and say the very first few days that occur, we'll start with $5,000, so that the cost to those that are participating is not going to be that high. And then the second one or third one, we will move up to $7,500 and kind of grow slowly, so that our numbers support how much we are spending and we are not having a lot of financial burdens. So what we are asking from this assembly is that they should give us a go-ahead to move forward with this program. And we are also hoping that the implementation will come from the stakeholders in a way that we will not be going to individuals to collect the funds. Whenever there is an occurrence, we will have Lecudo USA, which will be one of the access points. They will have someone who is collecting for those members that participate directly through Lecudo USA. Lecudo WDC will collect its funds and send it in bulk. Ohio will do the same thing. The village associations that do participate will also do the same thing. So, and how they manage that, we just give a proposal to say maybe they will go to the members and say, everybody contribute $50, they keep it there, and then when there's an occurrence, they pull out of that amount. And once the money is depleted, they can come back and start all over. We will not tell them how to manage that, but we just want to say they will figure out how to manage that on their own. So, like I said, we want the Assembly to review this proposal that we are putting in front of you. We want you to make recommendations so that we can improve. We know there is a lot of room for improvement. We are open to improvement. This is not a final draft. It's the first of so many drafts that we'll see. And most importantly, we want your approval to move forward because we have to do something for ourselves. We cannot keep depending on everyone else to tell us how to run Lecudo. This is our thing. And I will give time for people to ask questions if the moderators will allow.
Good evening, everyone. We stand here to represent the Health and Wellness Committee of Lecudo USA. These committee members, we are 11 of us, and we have several proposed health initiatives and budget. First, I would like to go over our objectives, which will be to forge collaboration and connection among our peers across the entire spectrum of healthcare settings, provide education on healthcare-related topics to all Lebang sons and daughters, improve access to quality healthcare for all Lebang sons and daughters, and then encourage mentoring relationships. Membership to this committee, I'm sorry, take that back. We have a platform, a forum, which is for healthcare professionals, nurses, physicians, chiropractors, and whoever is in the healthcare field. And we have them on the presentation. Some of our initiatives we are thinking of working on. In Cameroon, we have reactivation of health centers in 5 villages, partnership with Mary Health of Africa to reactivate their hydroelectricity plant, hypertension and diabetes screening campaign in Chang, and then evaluating the Catholic health insurance scheme, which Dr. Edmond is going to talk more about. And then in the USA, we already launched the Lebang Healthcare Professionals Network, and we hope to expand access to this network. And then we're going to have monthly health education talks.
All right. Go back to, she was giving you an overview. Go back to the second slide, please. Yes. So just said that. So here are the health committee and wellness members. I think we had one of the most productive committees, which is not by accident. There is one thing that everybody actually has, which must be a fundamental human right from us, and that is your health. So, and we took that challenge very seriously, especially given the lessons that we learned from COVID. And if you look at this number of people within that committee, these are the people who work tirelessly within the committee, and we held several meetings, probably more than maybe about 8-10 meetings. And then go next. So in Cameroon, as we said, we are trying to look at the health of our people in Lebang, and one of the things that we thought was to pick up from where Lecudo had actually started before. And even though that project didn't really go as planned because of the war, we had gone back to looking at the villages, reactivating some of these health centers. so that at least the areas of concentration where our people are now, at the very basic minimum, they should have some some semblance of health center where if they have issues, they can really go there and get some care. Areas that we're thinking would include places like Bindia, Atonga, where there are people concentrated, Belenge, and then I think one of the other around NGE, and just blanking on the Mbu, and Balua was the next one that we're thinking about. So, and of course, we will have to rehabilitate the Mary Health of Africa. You people heard about from the folklore. When that hospital was built, there was hardly any person from the bank who could boast of a salary of 100,000. Here now, we are seated here. People can actually boast of income of wherever, maybe 2.55 million or 10 million in CFA, probably per year. There are people with businesses who can have it per month. So we really need to dig. In that hospital, the generator has actually completely broken down. And right now, what we have done was to ask for a budget. We actually committed some funds to go and actually take care of the area where the hydroelectricity plant is, so they can build it and they clean it and take it out and probably clean the forest around it. But the engineer is going to leave Italy and go back there and see what is actually wrong, and try to rehabilitate that, because of the absence of electricity, as we would have heard from Ms. Arikalis, which we don't have to go back. She did our work for us, so we don't have to go back to recount that. The medications, sometimes it's very difficult to store medication, so that light issue becomes critically important. So we need to tackle that. And I think this part of this, the diabetes, hypertension, and screening, Dr. Emijo is actually a primary care physician, and I'm going to let her cover this because this falls in her purview. And the reason why we chose diabetes and hypertension, these are very, very common diseases. If I would randomly screen our people in here, I will be hard-pressed to not find 1/3 of us with either or both of these diseases. And hypertension is called the silent killer. And so we want to get something that really gives us an impact. So I will let Dr. Emijo actually talk a little bit more about this slide, and I will pick up from the other things that we are actually looking at to tell you the process.
Thank you, Dr. Edmond. So I am Dr. Emijo Beckham Kemkia, located in North Carolina, and I'm primary care, which means I am a general practitioner. I see everybody from babies to the elderly, 99 and over. Blood pressure, diabetes, those are common things that we see every day, and some of these, a lot of them are preventable. People back home, unfortunately, they don't have access, or we don't believe in preventive care. So a lot of people don't go to the doctor until they're sick, which is the wrong way actually, because you should just get your regular checkups annually. But people wait until it's already bad before they go see a doctor. Part of that is because there's not enough resources anyways. So we're trying to help, break that cycle. So we plan to collaborate with the people back home to provide these preventive measures. Once we get this started, the people back home on the ground, they will be able to run some fairs where they will do these screenings for our people. It will be free of charge. We will just support them with some of the resources such as blood pressure cuffs, monitors to check for their sugars, diabetic monitors, and stuff like that. And so this also goes for us here in the United States. So it's not just back home. People here in the United States still have that mentality. Our people, we don't go to the doctor until it's too late, until something is hurting, until you feel chest pressure or something, that's when you go to the doctors. That's wrong. So we are going to be doing monthly health talks. These are free health talks. It's going to be online, YouTube, in collaboration with Gaza Media. And this will be on topics, common topics, giving you some perks, how to recognize these diseases, how to prevent them, and how to seek treatment, or when you go to even see a doctor, what things should you be asking? What things should you be talking to your doctor about? So that's what we hope to achieve. And in that regard, I was passing out some papers right here. Did everybody in the hall get a piece of paper scrumbled up like this? Yes. Okay, get one, please. Come on. This is free. Courtesy of the health wellness. You're going to win a prize if you pick a lucky number. So let me help you. Thank you. Thank you. So please pick a piece of paper. Over here. Just raise your hand if you didn't pick, so that they can. Just one. Just one. So the prizes are going to be a Fitbit, a blood pressure cuff, lots of goodies. So make sure you grab yourself one. And I'm going to. Who win the house? I'll read the prizes right after the talks.
Okay, talking about our budget for these initiatives, we've mentioned several health initiatives. Our budget for that is going to be $5,000. That's what we are requesting from Lecudo USA. And then for the hydroelectricity plant itself, to get the generator at the Mary Health of Africa Hospital working, that is the $4,000 budget. So total, we are asking for a budget of $9,000. Whatever is being passed out today is not part of our budget. That was from the Health and Wellness Committee itself. And then I will just let Dr. Edmond talk now about the health insurance scheme that we also talked about very briefly.
All right, please hold on to that. There is another very big project. Can you go? See, here in America, all of us, many of us can go to the hospital only because we have health insurance. Or there are some free health centers that we visit. In Cameroon, our people are not so lucky. And the reason being that they don't have, when they don't go to the hospital, sometimes it's because they don't have the money. And we know this all too well within our own families. And like Emijo was telling you, when you don't go to the hospital, things that could have been preventable and cheap to correct, things that you could cure, you end up actually having to only mitigate, and at the end of the day, they become very expensive. And so with the so much work that we've done in Cameroon, helping in the background, we came across this PEPFAR program, which is the Bamenda Ecclesiastic Province Health Assistance. Our goal is to provide all our people in Leban health insurance. And I want to take a little bit of a moment to talk to you. I hear people talking about, maybe time. These to me are the critical things because you can save life and you should save lives. So this program was actually began in 2007 and it's run by by Father Lois. And it was actually provided, they run through the bishop by a grant from the bishops in Germany who were sponsoring about 75% of this project. But they had given the diocese, the archdiocese about, from between 2014 to 2020 to come up with a number of people that would pay the premiums large enough to be able to make the program sustainable so that the grant could, while the grant ended, the contributions from members would be able to continue to sustain the program. But unfortunately, because of the war, people got displaced. All the schools that were enrolled in this program, they also got displaced. And then, so it created a very big budget gap, a budgetary gap. But when we were talking, we finally found out that, and our people in Leban and the BLM generally were already, some of them were registered in this program, which we did not know. So one thing that the program, you register with 1,000 francs CFA. Taku, can you go to the next project? You register for 1,000 francs CFA. You pay 4,000 per annum as premium, and then pay 1,000 for an ID card, and then there is 1,000 for their annual conference. Now, with that budget that you have, can you go? Let me just show you what the benefits are. Go up. No. Yes, keep here. So this is a look at this table and look at this table critically well. So if you have a family of 4, each member is going to pay 4,000 per premium. So it's 4 times 4 times 4 is 16,000. The registration fee is per family. So that 1,000 is per family. The ID card is actually, per person. Per family, and then the photo ID, the annual conference is per family. So you see that per family of 4 is actually 19,000. If you have a family of 1, you pay the, you're going to spend about 6,000, 7,000 being. So now, when you do this, Taku, can you go? I want to show you the benefits. So in terms of the benefit, this is what these people can get. For that little amount of money, the patients can have they can see a doctor up to 3 times a year. And the insurance will cover 75% of the cost up to 15,000. So that means that at the end of the year, for 1 year, the person can benefit up to 45,000 in consultation. They can also benefit up to 50,000 in hospitalization, in hospital admission, and they can benefit up to 25,000 for delivery and 70,000 for surgery. So this is huge. And what we have actually done, as we've been in this problem, I have been working back and forth with Father Louis. They've signed, knowing that our people are actually more now in Chang and the Western Province. Father Louis, who is actually based in Mamfe, had to displace. After our several conversations, he had to displace himself, go to Chang to get a partnership with the biggest Catholic hospital in Chang, which is actually the best hospital in the West Province, so that our IDPs can benefit from this program. As we talk, he's also en route to Douala. On Monday, they will be signing a partnership so that our IDPs in Douala can also benefit from this program. So what we mean by this, if you can only come out of this, knowing that each one of you, just with 5,000, just with like 5,000 a year, you can actually give one of our own people the comfort of being able to see a doctor and get all the things that they need up to the amounts that are just documented here. What more can you give our people? So to me, I would tell you, like being somebody in this profession and knowing what I do and the challenges that people have in Cameroon, this is the best thing that we can do for our people. And so as we finalize this project and come up, the way I envisage it to the committee, the wellness committee envisage it to work would be those of us that are in here and have families in Cameroon, we are going to register our people independently, our families and our relatives, and so we should register them. Number 2, the village associations, let me say Jens Sanji, Lekong, and so on, we should also get them to register the members of that village, spend the money and register. So Lecudo would then come to register all the bank people that could not be covered through these processes. So we have a team in Chang of our own people that are working with Father Louis to establish the names of the IDPs. Father Louis already visited, and I can share, for time constraint, we may not be able to do it, but I could have shared a lot more of this information. And I urge you, please, 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 if we can do it, if the folklore could do what they did over 50 years ago, over 60 years ago, before some of us were actually even ever saw the light of day, and at this point, this is what I urge you people to really work with Lecudo, work with your village associations to make sure that this project see the light of day. Thank you very much.
And if you got a piece of paper, you can open it up. You either have a blank or you have a yes. If you have a yes, you get a prize from the Health and Wellness Committee, and Dr. Emijo would be passing those out. I'm sorry, number 1 to 30. I'm sorry. If you have a blank, you don't get anything. I'm sorry.
Dr. Emijo will come round and see your paper and tell you what you have. At this point, ladies and gentlemen, listen. Listen, this convention.
The bylaw has just been adopted. It's become the legal document of the organization right now. So probably we are waiting for, right now we are waiting for the financial secretary. He just handed a piece of paper.
We need questions.
That gives a lot of expensive income and expenditure.
Look.
So that is what people are actually waiting for. I think the host or the owner of the hall has told them to leave the hall in 30 minutes. Otherwise, they won't be able to come back here till midnight, which will be very difficult. Time factor has always been an issue.
I believe everyone has this document.
Media.
I don't think there's any need to project this financial statement.
Out of time. So, and now
you guys agree, right?
Is on the floor.
Looking at it, right?
Right.
Like you have to run it because we are starting in February.
No. I'm saying that there's no need to project. Yeah, I'm going to go through it, right? All right. There's no need to project because I believe everyone has this document. So I just did this as easy as possible. Like, starting from February the 4th, we had a balance of $62,284.75. That's actually what was handed to us when we took office. Okay. We understand that there might have been some checks ordered, and there was a reversal for that, and the amount was $45.41. We had some money coming in from VIP table sales, which I think Mr. Oliver paid $300 for that. We also had a village association meeting in Chembin, paid $200. As well as if you have your questions, please you ask questions at the end, okay? All right. As well as Zelle, payments that came through Zelle as of this evening, 6 o'clock, those payments sum up to $4,550. So we will expect $67,380.16 in the bank account, but that's not true because there have been some expenses, which you will see from February 17. Postage fees to send documents to Dr. Edmond, $8. Yearly Lecudo USA Convention Zoom account, which we're using today, $163.39. Humanitarian assistance check for $17,490. Web hosting our website for $287,000. Election voting system for our last election, $60. Another postage for signatures to be completed so we could have access to the bank account, myself and the treasurer. That was sent by the secretary to us. That was $8. And then tax accountant was paid $375 to prepare taxes for us. Then there was another postage fee for 55 cents. I believe this was a check sent to the former CEO. Then humanitarian trip to Chang. CEO was in Douala and of course was asked to go to Chang to distribute some food items, which of course we showed that the expenses for $227.15. And on July 1st, we have $3,000 loan as a loan. This is actually a loan. This money is expected to come back with interest. It was loaned to WDC chapter so they could buy and sell drinks, right? The actual convention expenditure is at $6,900, but it's a $3,000 loan, which we expect to see coming back with the profit, whatever profit is made from that. Then we also have the last postage of $24.40. That sum up to $28,544.09. So if you less that amount from the $67,380, what we have right now, I took screenshots, I don't have time to be showing that, but if people want to see, I can show that, but as of this evening, right now, there is $38,836 in the bank account. And you need to understand that all of this expense